Here's why I like to do myo before or co-occurring with palatal expansion. And these are the reasons why. So this palate that you see here in this picture was recently expanded, no prior myo, no understanding of tongue placement, tongue function, oral resting posture, nasal breathing. You can see they're holding the front upper centrals together with a light wire bonded or glued to the back of the teeth to hold the space, but also hold the space. And I'll show you in the next slide why. So here's the smile view, and you can see in this photo, this was just after removing the palatal expander, there's a very thick, heavy frenulum on the upper arch or maxillary arch that wasn't addressed. And also pay attention to the top back teeth, the baby molars there. They're not inclined at all. Maybe just slightly, but there's also buccal ties that are probably like a grade 3. They're just passing the free gingival margin, heading towards the clinical crown of the tooth, so that you can also see where there's blanching of the tissue on the attached gingiva, which is the gum tissue that's right above the tooth itself. So keep in mind this photo and the prior photo. This is recent expansion, no prior myo. So this is after without myo. Look at how the teeth have shifted. Look at the inclination or how the upper teeth go in and the lower teeth go in as well. You can see the shifting on the upper right side more so than the left. The upper arch is sliding a little bit to the right, and the lower arch is also sliding a little bit over to the right. So this is why I love myo before. This is also what the dental arch looks like on the lingual surface, or if you're looking at it from underneath, this is where the tongue would go. So if this person had myo before, the pressure from the tongue would have complemented that palatal expansion and kept this dental arch nice and wide, and there wouldn't have been what I would call some relapse. And you can see that bonding on the back front two teeth, that bonded retainer. You can actually see space now because the oral ties weren't addressed. And if they have myo prior to that expander going in, they're actually able to hold their tongue in their palate because there's muscle memory, and the tongue has the capacity to do so because it learned through this neuromuscular evolution of retaining this muscle memory and these movements and strength and tone to do so. So I wouldn't wait until after ortho expansion and then 3, 4, 5, 6 months just to get the tongue to be able to do this. And then if there's a tongue tie that needs to be addressed, we're talking more time. I want that tongue to go right away and know right away where to go and have the capacity to do so. And that's done by co-treating at the same time before ortho expansion and or during phase 1 of myo. We can do phase 1 of myo while there's an expander in. And this is what the expander looks like. And this child was able to suction, hold, and is very proud to show us all what they can do with that expander in. So as soon as they get this off, I am going to be seeing them right away, or maybe even right before, and saying, what do we remember? Where does our tongue go? Let's work on nasal breathing. And it's going to be much easier now because there's more tongue space, and there's probably some more space behind and above below their nose to breathe out of.